This is the P2P program for the superficial and deep front lines. So we're going to distinctly show the difference between activation and inhibition in this one. So what I'm going to do is the tibialis anterior here runs just sort of lateral to the tibia. So we're going to make sure that we're not on the bone, but into the muscle itself. And again, you don't have to be super accurate about this. We're going to use a level 1 vibration. I'm going to use the spear, but you could use the viper, no problem whatsoever. So just gentle pressure. Now what she's going to do is we're going to add a toe pull. And I can actually help and assist a toe pull as well. So there's not much that I need to do here other than vibrate. So usually about 6 to 8 repetitions here. I can gently cup my hands under her foot if I want to and sort of just help the mobility just a little bit. Nice and easy, breathe. Good, excellent. She's going to continue to work through this. So again, the point is to engage the process as much as possible. So that's tib anterior activation. Now we're also going to do inhibition. Okay? So in this case, we're going to use the viper. Is it turned on? Okay. Good. We're going to again use. We're not going to use any vibration whatsoever. Okay. So no vibration. Okay. So we're not going to use vibration for this. Now, for the purpose of this, is going to be a fascial glide. So in this case, we're going to use an inhibition protocol. We're going to go high thigh. So Shelly's going to get up into a high thigh. Generally speaking, it's the vastus lateralis and rect femin sort of tie down that usually gets glued up here. So what she's going to do is she's going to do what's called, she's going to find a spot, obviously, again, techniques that are taught during the seminar. Find the spot using search and destroy techniques. She's going to gently squeeze her glutes just a little bit so we want the hip flexors to engage. She's going to pull her heels as much as possible, and I'm just going to glide it just that little bit further. Good, excellent. How's that feel?
Good.
Excellent. So if it's really sore, obviously sometimes you either have to put a foam mat under there, or you have to back off on the amount of stretch that you add in here, or somehow maybe even take some of the pressure off the foam roller for the client. Either way, the point is we're not vibrating because I want fascial glide to occur. It's not that vibration can't be used, but to clearly show this is an inhibition protocol. 6 to 8 of these is usually sufficient for this. Good. So now we're going to move on to a 3-way hip extension. So this gets into using, so this ball is pretty aggressive. I would recommend a softer ball for this, maybe even trigger point MB5 possibly. But again, we're not going to vibrate. She's going to find her belly button. She's going to come lateral from the belly button just to the side of the abdominals, so where the abdominals drop off. She's going to lay it there. She's going to drop down to her stomach. It's going to be on the right-hand side. Okay? So this is an aggressive technique, but the ball is fairly large, so this shouldn't be too bad. Good. So you can see the placement of the ball. She's up on her elbows. She can put as much weight on her elbows as necessary to make sure that this is not uncomfortable. So what she's going to do is she's going to just sort of gently pry herself forward over top of the ball, which then creates a lengthening glide over top of the psoas muscle that's lying to the side and under the abdominals. This works quite well. Good. She's going to do this 4 to 6 times. Nice and inhale. Exhale. Good, because this would be very uncomfortable for people. So again, judge the client accordingly. You may have to do some of this work. You may even have to use vibration ahead of it. But this is, again, a pin and move technique because we're using inhibition protocol. Okay? So now, second process here is we're going to use hip extension. So she, again, as much pressure as she needs on her elbows, but ideally she's going to lay down flat this time. So she's going to lay up flat. Good, now that puts a lot of pressure. So if it's causing problems, she stays up on the elbows. So now she's going to keep her legs straight and she's going to do hip extension. So she's just going to move back. Good, and breathe back down. Inhale. Exhale. Good, we're looking for nice clean hip extension, making sure the hip's not rotating up too much. She's doing a great job. Again, anywhere from 4 to 8 of these. Generally, somewhere around a minute's worth of work is usually sufficient to cause inhibition. Awesome. Now we're going to move on to the TFL. We are going to come back to the, again, using inhibition protocol. So we're not vibrating, not to say you can't, because you totally can. She's going to place this on, so the TFL is lateral or sort of anterior to the IT band. The IT band comes up. It's the anterior portion of the IT band. It's going to come off your iliac crest, and it's a meaty piece of hip that's just forward from your femur and in between. So it's between your femur and your iliac crest. So in this case, what she's going to do, she's just going to pin it, and she's just going to, what she's going to do, she's going to shift side to side. So very slow though. So it's a long, slow. The TFL can get quite glued to the femur, so we're going to try and shift it. So we're going to try and move that tissue, but in a slow way, so it still that the overactive tissue from the sitting disease or overactive hip flexors begin to relax. Anywhere from 10 to 12 passes here, or again, somewhere between 30 and 60 seconds of inhibition is more than sufficient to have that overactive muscle start to turn off. That is your superficial front and deep front line P2P corrective exercises using vibratory technology.